Hello. Let us now study about one of the atypical cervical vertebra, that is the number 2 cervical vertebra, second cervical vertebra, which is also called as axis. It is atypical, it is different from a typical cervical vertebra. Simple, there is only one basic difference, that is this hook-like projection is seen from the superior surface of the body here. This makes it atypical, and this process we call it as odontoid process or dens. Because of that one reason, this becomes atypical. Now coming to the features or peculiarity, it is the strongest bone, that is the strongest of all the cervical vertebra, and it consists of the body in front here, and this is the hook-like odontoid process from the superior surface of the body. So this is apex of that odontoid process to which apical ligament of dens is attached, and by the sides of it, it is the alar ligament which is attached. Now coming to this body, this is the anterior surface of the body. In the middle of it, it gives attachment to the anterior longitudinal ligament, and on the posterior and on the anterior surface of this odontoid process, there is an oval facet which is meant for articulation with the facet on the posterior surface of the anterior arch of atlas like this. So that is this facet. And coming to the posterior surface, here it gives attachment to cruciform ligament, membrana tectoria, and posterior longitudinal ligament from above downwards. This one is the posterior surface of the body, which consists of numerous foramina in it meant for the passage of the basivertebral veins. Now coming to the sides, this is a superior articular facet which is fat and facing upwards, which articulates with the inferior articular facet of the atlas. Is it clear? Forming an articular pillar here. Then coming to the foramen transversarium, this one already we know vertebral artery, vertebral vein, and sympathetic plexus are its contents. Now coming to the tip of the transverse process, it gives attachment to the scalenus medius, levator scapulae, and some deep muscles of the back. Then we have this one, the lamina. To the lower half of the anterior surface of the lamina, it is the ligamentum flavum which is attached, and this is a spine which is bifid, splitting into two, and this spine gives attachment to the ligamentum nuchae. So this is in brief about the attachments, and you can also have the attachment or the origin of rectus capitis posterior major here onto the spine, and onto the superior border of the lamina, it is the inferior oblique muscle which takes origin. Similarly, here on the sides of the body, of the sides of the midline in the posterior arch, in case of atlas, it should be rectus capitis posterior minor on either sides which takes origin. So this is in brief about the second cervical vertebra which is called as axis. Thank you.